know where the source is. So Gauteng province can't just respond like any other province because we are the most vulnerable. When it comes to the economy, once the economy is hardest hit, it is this economic hub as well. That's the most vulnerable. South Africa's economy cannot recover if we in Gauteng don't do extraordinary things. So those are my remarks, and thank you so much. I would like to give can you do this in 15 minutes, Muzi? I want Muzi to share with you some of the crunch numbers that our team has done, the team of economists has done, just on the preliminary sense of the impact on the Gauteng economy. I want Muzi to be healthy, so when we give him the mic, we will sanitize it as well.
Thank you, Premier. Am I audible?
Yes.
Thank you, Premier, for your address, as well as remarks. On behalf of the collective that is here, or as a collective, we cannot begin to express how honored and privileged we are today, as you have really set the tone around the challenges that we are facing in light of this pandemic. Indeed, you have set the appropriate tone, calling for us to look at extraordinary measures that we can implement in ensuring that our economy doesn't collapse. Muzi, you have your marching orders, 15 minutes. I hand over to you.
Thank you, Program Director. Premier, MECs present, colleagues from provincial government, and most importantly, leaders from businesses, gateways of the economy, thank you for taking the time to be with us. As the Premier has indicated, we are part of a team that is basically leading some of the economic work that we as the province have to basically roll out in order to address this. So what we've prepared for you this afternoon is basically a sense of what the likely economic impact will be and the sectors that are likely to be affected, as well as some of the interventions that we are currently simulating in order to be best prepared for this unprecedented once-in-a-lifetime crisis. But just as a quick recap, what we do know is today is the 83rd day of the COVID-19 virus. The first case was really on the 29th of November from China. For a while, it was mostly seen as a pandemic that is localized, that is centralized within Asia, but what has become apparent is that this is a pandemic that is global. In fact, as of Tuesday, we had more cases outside China as compared to China. What we do know today, the latest data shows that we've got approximately 250,000 cases in the world. 202 of those are in South Africa, of which around 110 are in the Gauteng city region. Unfortunately, the data we have at hand shows that 9,900 people have lost their lives. This is basically the spread of what COVID-19 has been throughout the world. So the transmission pace that has occurred is it moved from the eastern side of the globe to the western side of the globe, and now with the numbers coming in, it's now filtering to the southern side of the globe, which is the rest of the African continent and ourselves as well. In terms of the growth rates, this slide really summarizes where we are in terms of the growth rate of deaths and fatalities of COVID-19. Initially, when you look at death rates per million people in a population of the country, we do see that the highest death rates per million population are currently in Eastern Europe, in Western Europe, and Western Europe has really been placed as the epicenter of the pandemic. But when we further unpack the data and we look at death rates per 1,000 infected people across the globe, what we are seeing developing is a trend where countries with less stronger health systems are showing higher death rates per 1,000 people infected. So what this data really shows us is, for example, countries such as Ukraine, Guatemala, and the Philippines have got death rates in excess of 10% of infected people. As I said, part of the risk with this type of modeling is that this is a disease that's only 83 days old. But as the data evolves, we are seeing different information. But what we are clear about is that countries that have deaths of infected people but have fragile health systems are showing higher than the global average of about 3% death rates of infected people. Just to bring the message home, so as of today, we've got 202 people infected, of which 109 of those individuals are in Gauteng. We are 20 days into our first COVID case. If you remember correctly, our first COVID case was on the 1st of March, so today is officially the 20th day. And on the 20th day, we have 202 infections. We have tested 6,400 people in South Africa. This is quite low considering what the testing rates in the rest of the world is. I mean, the United Kingdom is now at 25,000 tests per day. So there's still a lot of work to do in terms of testing as well as procurement that is related to the testing or equipment. As I said, I'm speaking in my capacity as an economist, so as such, I'll move away from the health issues. One of the key, what is very clear is that the transmission mechanism of COVID-19 economically will be through trade disruption and the slowdown of movement of people and goods and services. And what particularly becomes a challenge for us as Gauteng is that 90% of our imports or goods and services that we get from the rest of the world are concentrated in basically Asia, Europe, and North America, which are currently the epicenters of the virus. So we expect that the transmission mechanism, basically in terms of weakening our economy, will come mainly from declining demand for our commodities from those countries, but also as well as from reduced supply from those countries as well, from most of the commodities that we use for manufacturing and that you as Gauteng suppliers use to produce the goods and services that you trade. So that can be framed as the first transmission mechanism that is likely to weaken us. The second one basically is restrictions on limited business and tourism travel. This is likely to be the fastest transmission mechanism through the tourism sector because it's basically a complete collapse of any movement throughout the world. And then the third, which is more of a non-economic impact but a social impact, is basically the rise of hysteria, the rise of behaviors that are not normally associated with the long-run average. We've already seen these affecting financial markets. We are going to see these affecting secondary markets, such as panic buying, cancellation of sports events, which has already crept in the rest of the world, and other panic-related behaviors. So in the rest of the world, these have been limited to cancellation of sports events, etc., cancellation of school events. We are yet to know how those behaviors will filter through to populations within Africa, where there's high inequality and resource distribution is quite spare. So I'm just going to walk us quickly through some of the challenges. One of the key challenges we've had is that over the past 30 years, Chinese production and manufacturing is heavily reliant on Chinese production. So about 15 years ago, China accounted for about 12% of global manufacturing, and today, or at least before the COVID virus hit, it was accounting for about 30% of manufacturing. So manufacturing in the world was heavily dependent on China. So disruption in China was basically the first knock-on effect that the global economy felt. But now that it's no longer just a pandemic that is confined to the Chinese economy, it's now in the Western Europe economy, in the American economy, this sort of transmission mechanism can be expanded to think of perhaps 80% of global production and manufacturing in the world coming to a collapse or a slowdown. As of last week, the IMF basically revised the global growth drastically by at least 0.4 percentage points of all major countries. But as of yesterday, our Reserve Bank revised South African growth by 1.2 percentage points from 1% to negative 0.2. So we no longer have the burden of anticipating whether we'll have a recession. We definitely are in research territory. So this COVID-19 is basically going to slow down our economy to negative growth rates drastically. And that will have meaningful impact to you as business owners and also to us as public officials who have to distribute service delivery at a certain cost. If one had to try and frame it into 3 building blocks on what is perceived as the three scenarios. We do have three scenarios at hand. One is a quick recovery scenario where the virus comes and goes and China picks up manufacturing, Western Europe picks up manufacturing, and North America also picks up manufacturing very quickly. The other is basically what was first deemed as the global slowdown case, where the global economy slows down for a fair amount of time, and eventually we do see within 3 to 6 months some sort of pickup in production from all key sectors. But all these scenarios were based before the World Bank announced this as a pandemic. So as of last week, this was a pandemic, and for a while the pandemic case was seen as the worst case scenario. So chances are we need to revise our spectrum of what is good, best case, worst case, and fair value in terms of this pandemic. Currently, what the indications we have and the data that shows us that basically we're likely to see China pick up production to pre-COVID-19 crisis maybe in 2021 Q1. And that's the best case data we have now, and that data could evolve dramatically if you factor in collapse in Western Europe as well as North America. In terms of sectors that are affected globally, I'll touch on the Gauteng sectors shortly. So the tourism and hospital sector, the aviation sector, the automotive sector, oil and gas, consumer products, consumer electronics. In the interest of time, I trust as business people that you have been following the news and you have an intuitive understanding why these sectors are being greatly affected. So as much, I won't really delve into why there is a total collapse or why these sectors are vulnerable. I think for us, what's important is really mapping which sectors in Gauteng are vulnerable, because as a trade open city region, our vulnerability is quite unique. So I'll just touch in terms of three regions where we get our goods and services. The first is China. So since 2014, we have traded 1.8 trillion rand worth of goods and services with China. And 76.9% of those goods were basically bound for Gauteng or came from Gauteng suppliers to China. So we basically account for basically 7 out of 10 goods and services that come from China or go from South Africa to China in this country. So that means basically China trades with Gauteng, and then 30% of that then goes to the rest of the country. And then if you basically try and map up what it is that we trade with China. So what leaves Gauteng is basically mineral products such as ore, slag, iron ash, mineral fuels, and coal and nickel. So a total collapse in Chinese demand, as I said, means basically appetite for these goods and services is basically thinned away. Also, what comes from China to enter the Gauteng city region is basically electric machinery, capital equipment, vehicles, OEM equipment, and articles of steel. So a collapse in Chinese production basically means that these goods and services have come to a halt. So key value chains that depend on these, or sectors that depend on the production of, or on the supply of these goods and services from China, are basically at 100% risk. The same story is accentuated when you look at our trade with Eastern Europe, Western Europe, sorry. So Western Europe is our largest trading bloc. We trade 3 times as much as we trade with Western Europe compared to what we trade with China as a country. And the bulk of our trade with Western Europe is really concentrated around advanced manufactured goods such as capital equipment, vehicles, as well, of course, our precious minerals. What we get from Western Europe is components for our OEM manufacturers, capital equipment, as well as vehicles and advanced machinery. So you see our exposure to Western Europe and China really affects our manufacturing sectors, as well as sectors that do sell these goods and services. Similarly, with North America, we have a similar exposure to goods and services in the manufacturing sector, in aircraft, in nuclear, in capital equipment, and in photography and in vehicles. When we unpack basically our exposure to China, we do find a very what I'll say a heightened trade to goods that you would not normally think of. So what this infographic shows you, for example, 50% of all umbrellas that we buy in Gauteng, we buy from China. 43% of all rail stock that we procure or import from the rest of the world, we import from China. 39% of all electronic machinery and 30% of all toys and games we get from that. And most of these goods and services are goods and services that are bound for the retail sector or are components of some sub-manufacturing sector. And the same trend becomes accentuated when you look at Western Europe. Printed books come from Western Europe. OEM equipment for our motor vehicle and auto vehicle supply chains come from Western Europe. So we do this assessment basically to dig deeper which sectors and which value chains will be sort of affected. So we didn't want to have an approach where we just give a generic perspective. And we do the same as well for say North America to see how exposed we are. So in light of this assessment, what we are currently looking at is basically, I think a very important aspect is if you look at the third point in Western Europe, 63% of all our pharmaceutical products we get from Western Europe. And that's quite important coming to what we conclude as sectors at risk for the Gauteng economy. Naturally, this being a health pandemic, the impact on the health sector is at the forefront. So just to give perspective, we currently have approximately 17,500 beds in Gauteng, and our city region is likely to be overwhelmed if managed measures are not immediately put in place. And from what we see so far in the past 83 days is the best resource health systems on the planet are even struggling to cope with this pandemic. So we therefore expect shortages in supply constraints on the health sector. But these will need to be managed with agility from public-private partnerships, as public sector alone cannot match this. Another linked sector to the health sector is basically the pharmaceutical sector. So China and India are significant producers of raw materials used in local production. What is concerning at this point is that India has announced trade restriction to COVID-19 related input products for export, and this will greatly affect our pharmaceutical sector. This is over and above the exposure of Western Europe that are highlighted, where 53% of all our pharmaceutical products come in Gauteng are imported from the EU. So we do expect a great degree of pressure in the pharmaceutical sector. Naturally, the bulk of goods and services that are highlighted from China find themselves in the retail and wholesale sector. So basically a decline in inputs into that sector is going to lead to lower margins and basically pressure in that sector, leading possibly to job sectors in that sector. That sector is quite important because apart from the public sector, it's the largest employer in the country. Capital equipment, which is quite exposed to manufacturing from China and Western Europe, plays a key role in construction of electricity, gas and water sector, and various boilers that need to be constructed for that sector. So that sector is greatly at risk as well. Also, we do expect some sort of impact on subsectors in manufacturing, such as railway stock and stock components. A key sector which will be impacted is obviously the financial sector. As we speak today, the JSE, the Johannesburg Stock Exchange, is currently at 2012 levels. I think close to 7 trillion rand has been lost in the JSE over the past 30 days. And this is due to combined shocks of the pandemic as well as oil price related geopolitical tensions. However, there's a likelihood that rising default rates in the financial sector from both businesses, households and smaller businesses will put bank balance shifts into significant pressure, and that pressure on that sector will basically filter through to the rest of the economy, possibly to what we saw in the 2008 crisis. Naturally, a sector that is very important for us as Gauteng is the auto sector. So as I say, the EU and the US account for 41% of all vehicle imports into Gauteng, and additionally 60% of all our OEM imports come from that region. So basically collapsing global supply chains will basically affect this sector drastically. This is a key employer of advanced skills and advanced manufacturing in the city region. So we are quite concerned about that. We also are likely to see an impact on sectors that are reliant on advanced manufacturing and electrical manufacturing. Naturally as well, because our ores that we are basically famous for in the Gauteng city region find themselves basically in East Asia as well as Western Europe. A collapse in appetite of any mineral ores is basically going to hurt the labor impactful mining sector. I think the other most important sector that will be affected by this and is being affected by this at a quicker rate than all the other sectors you've highlighted is the tourism sector. But basically to paint a picture of why tourism will be hit hardest and quickest than any other sector, this infographic basically gives you a perception of countries throughout the world that have basically shut down their skies, whether it's total quarantine, total travel bans, or some sort of significant measure of limited flight. Basically, this is the rest of the world has basically shut down the skies. And if you look at where our tourism visitors come from in South Africa, the first 8 of those come from countries that have been hit severely by COVID-19 and have either totally shut down or have reduced significant traveling. So it is likely that we are going to see a total collapse of any sort of travel from those sectors. But over and above that, our local sectors, such as the restaurant sectors, are likely going to basically implement social distancing to basically limit activity in those sectors. And these are also significant employers as well as a significant source of income. So the tourism sector, from our perspective as Gauteng province, is perhaps the most immediately vulnerable sector, apart from the other manufacturing sectors that we've highlighted. What we've seen to date is that governments throughout the world have come up with various measures, and those measures can really be categorized into sort of like 3 pillars. Monetary policy measures, these include drastic monetary expansion and unprecedented reduction in interest rates. I mean, I don't remember the last time I had 100 basis points reduction. Injection of liquidity into economies, but we've also seen extraordinary fiscal policy measures, such as increased government spending to prevent, detect, control, and treat COVID-19, wage subsidies to people and firms to help curb contagion, expansion and extension of transfers and grants to vulnerable population groups, tax holidays and tax relief and businesses in vulnerable sectors. But I think caution to the wind, as Premier said in his remarks, I think we have limited fiscal options as a provincial government, but we'll look to our national leadership in terms of this sort of implementation of both fiscal and monetary measures. But then the most important measures that have been put in place are really health-related measures that limit the interaction amongst peoples, and these are social distancing measures, basically from cancellation of common and major social events, social curfews, putting a limit on the number of people that are expected to interact, as well as work-from-home measures being implemented in sectors where that capacity exists. We as the provincial government have also been at the forefront of trying to see how best we can respond to these type of measures. So we've put together the team that I'm part of, which is basically the modeling team. And the purpose of this team really, apart from the preliminary work that I've just presented to you, is basically to be very prescriptive on what to do in each of those vulnerable sectors within the ambit of what we as a provincial government can implement, but also to solicit some sort of input from you as a public sector, private sector, on where you can assist. So we are modeling and quantifying risks and job losses and business closures per sector, per vulnerable sector that we've identified, driven by supply chain issues, cash flow, liquidity challenges. We're also measuring the fiscal budget that we as a province have available to see what we can shift and optimize. Bear in mind that we have approximately 142 billion in the purse, and which we'd prioritize for other goods and services, but we're in the process of trying to see how we can still shift in the ambit of still delivering vital service delivery, but also addressing the pandemic that faces us. We're also in the process of developing stimulus responses in terms of how our spending, our regulatory policy might need to change in order to basically meet this. There'll also be other issues that we need to address and have answers for you, such as how we'll shift our public procurement patterns to make sure that sectors or businesses, particularly small businesses, will be able to be capacitated to meet some of the production challenges we will see in key sectors such as the health sector and the pharmaceutical sector. I think I'll leave my presentation here and hand over to the program director. Thank you so much. Premier, thank you.
Thank you, Muzi, for the presentation. Because the South African economy, and by extension the Gauteng economy, has not been functioning as a closed economy, we remain vulnerable during this pandemic, and we shall be severely impacted. Muzi has outlined the potential and absolute impact from a global perspective, the South African perspective, and the Gauteng economy. And whilst we deliberate on these scenarios that he has painted for us, it is equally important to have an appreciation of the impact from a social perspective, and in particular, from a health perspective. And on that note, I would like to call upon Dr. Masuku, who's our MEC for Health in the Gauteng province, to address us. Thank you, Dr. Masuku. Premier, can I have, I don't know.
Admit patients. At Para and all other hospitals, we have already extended beyond the 3 hospitals that we had identified initially. So currently we are sitting around 500 beds that can be utilized within our own actual capacity. But the second part about this is just also our capacity to run ICU and high care actual system. We know that that's a big problem. So one of the things about it is just to have a discussion with our private hospital groups, just to see how much access we can be able to get for when we really need that actually serious service. The issue of laboratory testing, it's an important aspect which we need to strengthen the capacity so that we shorten the turnaround time actually for the results, and we're able to deal with it. And the other aspects is the medical services and also just to continue to see our key entry points, because that's where our major problem is in Gauteng. It's our ability to screen in OR Tambo. They do have a semblance of what they do, but there are instances where we were told and reported that there was no one who was there to do the actual screening. And that's where the problem is, but it's some area that we want to deal with to make sure that we increase it. So number 7 is just to make sure we continue to inform everything. So these are the measures that we've taken for all our facilities, all GPG facilities and government facilities, particularly those who will remain open after this period. We have regulations that were published by DPSA, just telling us who should be the ones that are supposed to continue working and continue to have actually contact. But these are the measures that we need to do for all our business buildings in terms of hygiene. And this is just a slides that show what the president actually spoke about, and in terms of just putting up the social distance